I'd like to begin this presentation by acknowledging the traditional custodians of the lands on which our work takes place, the Wurundjeri people of the Kulin Nation, and pay my deepest respects to the elders past, present and emerging. My name is Jackie Evers and I am the team leader of Youth Health Promotion at Merry Health. Today I'm here with my colleagues Nazish Khan and Kat Thorne. Together we work on the Ready Set Prep initiative, which is a place-based collective impact approach to supporting early childhood development and improved life outcomes for children and families in the northern suburbs of Moreland. The Ready Set Prep partnership first formed in 2017 based on identified community need. Initially, the project was centred solely in the suburb of Fawkner, which is in northern metropolitan Melbourne, approximately 15 kilometres from the city. Communities in Fawkner experience high levels of socioeconomic disadvantage, with Fawkner rated the 28th most disadvantaged suburb in Victoria. Fawkner is also highly culturally diverse, with almost 50% of residents born overseas and many of them being newly arrived. In 2015, the results of the Australian Early Development Census, or AEDC, showed that 37% of children in Fawkner were starting school developmentally vulnerable in one or more of their development domains. And this statistic was significantly higher than the Moreland or Victorian proportions, which were sitting much lower, around 20%. For those that may not know the AEDC, it measures social, emotional, physical, language and communication development, providing a snapshot or one piece of the puzzle to a child's overall well-being at this pivotal transition point in their lives. Coupled with many anecdotal reports from local teachers about challenges for children entering primary school and difficulties with engaging parents, this prompted local partners to get together and discuss the need for a collaborative intervention in Fawkner. Over the years, the focus of the Ready Set Prep project has not been directly on improving mental health as its primary outcome, but rather on improving health inequalities for children and families and bridging educational disparities. Yet, given the inextricable links between mental well-being, early life outcomes and education, we are excited to share with you the Ready Set Prep model and the lessons that we've learned along the way. So 4 years of initial funding was provided to the Ready Set Prep partnership by the William Buckland Philanthropic Trust. And over these first 4 years, Merry Health worked mostly with the 5 local primary schools in Fawkner, focusing on 4 key activities. Firstly, sharing key messages about early childhood development and local services. And this has included the development of a co-designed video series featuring local people, places and spaces. Secondly, some organisational development approaches to improve transitions and create more welcoming and inclusive schools. We also employed a family engagement officer who worked directly with families, linking them to services and supports. And lastly, we established a transition network or community of practice for teachers. At the end of our first 4 years, the Ready Set Prep team conducted a thorough evaluation, which has been used to inform the next phase of the initiative. At the end of 2020, we were awarded a further 2 years of funding funded by the Helen McPherson Smith Trust. Coupled with our core funding from the Department of Health, this allowed us to employ a dedicated bicultural community engagement officer, facilitating a big shift in our work to become much more community-centred rather than partner-driven. To inform this next phase, a representative steering committee was formed, comprising of members from local schools, early years, local settings, and community members themselves. We also redesigned our entire governance structure with community represented at all levels. At the beginning of 2021, our new steering committee came together to look at the last 4 years of work and to redesign the next phase. Together, we reviewed 28 most significant change stories, interviews from 157 community members and 23 service providers, population level data, including the 2018 AEDC data and the NAPLAN, preschool attendance data and attendance at maternal and child health checks, as well as child voice video clips. Based on all of this, the steering committee made a couple of significant changes leading into phase 2 of the initiative. We expanded the initiative into the 2 neighbouring suburbs, Glenroy and Hadfield, where AEDC results were actually declining. We also expanded our partnership. At the start of the initiative, we were partnering with just 5 schools, and by 2020, we had over 40 partners. We also expanded the initiative to have a focus on birth to 6 years rather than just the school transition age. And we also adopted a focus on engaging with community and really authentic co-design. So next, in 2021, the Ready Set Prep Steering Committee came together to create a new theory of change to guide our collaborative partnership work. For those that are not familiar, a theory of change can be conceptualized as a roadmap, guiding you from the resources you have at the bottom up to your high-level goal at the top, with your medium-level impacts and short-term actions in the middle. Over a series of dedicated workshops facilitated by Clear Horizon Consulting, the Ready Step Prep Steering Committee agreed on our theory of change, which has become our guiding blueprint for our collective work. And once developed, the theory of change was then tested and refined with 3 community workshops and 37 community members. Our new co-designed goal for Ready Set Prep now declares that more children and families in Northern Moreland are school ready, with improved early childhood development, wellbeing and life outcomes. I'll now hand over to Nazish to explain the details of what we actually do in order to work towards this higher level goal at the top.
Thank you, Kathy. Ready Set Prep has a focus early in the lifespan to give children the best start to life. Our theory of change identifies 7 key interconnected activities that provide different soft entry points to the work of Ready Set Prep. It also means that work happens across the community in environments where children live, learn, and play. Some of our activities support services to improve the quality and inclusiveness of their environments. Through facilitating a community of practice or a transition network, educators and teachers in early childhood services and primary schools participate in a collective professional development, localized discussions, and relationship building opportunities. Our Ready Set Prep team additionally supports 5 settings to review and improve their transition processes, as a positive experience can increase positive social, emotional, and academic outcomes for children. Together, services work to document processes, share lessons with each other, and undertake audits around welcoming and inclusive environments. And we also have systems to collect family satisfaction data in regards to transition to support family engagement, as interest in a child's social and school life encourages good mental health and well-being. The wider Ready Set Prep partnership has also collaborated to deliver online workshops for families on topics such as NDIS navigation and school readiness. Feedback from the community has reflected that these workshops resulted in increased confidence and better understanding of support services for families. We also hope that working in partnership will increase cross-referrals and integration between early years services, again, supporting family access to services. We have recruited 10 community champions who are passionate about the aims and objectives of Ready Set Prep initiative and are good at connecting people in their local communities. These volunteers work in partnership with our Ready Set Prep team and partners to share key messages through their networks. This aims to enhance information flow between communities and services and improve access to local early year services, as well as building their knowledge about local services and parenting supports. Community champions have built their confidence and leadership skills through attending training, increasing social connections, and contributing to their community. Subsequently, we've seen community champions engaged in multiple working groups, further building their skills and confidence. Given that parenting skills, self-esteem, and connection with community impact family functioning, this model provides benefit for families and the community, as you can see by the quotes on the screen. The messages shared by community champions align with the phased communication plan comprised of 10 co-designed key messages. These messages are shared in a variety of ways, including short films, posters, social media, WhatsApp, and in monthly e-newsletter, which is created in partnership with Melbourne City Mission. To contribute to the breadth of helping parents raise children, we also provide information about upcoming events and activities, as well as COVID-19 restrictions and vaccination information to help parents and carers and support family well-being. All of the resources, key messages, and local solutions that have evolved from Ready Set Prep have been co-designed with stakeholders and community members to specifically address the challenges or barriers for local children and families. Where required, working groups have been also established to focus in on those complex factors. These groups have been made up of service providers and community members, and they've been able to identify local solutions, creating a sense of ownership. Specific areas of focus for the working groups have included increasing maternal and child health attendance, developing the 10 key messages, planning a school readiness workshop, addressing school starting age queries, and accessing service information. Ready Set Prep offers universal supports to encourage safety and inclusion. However, the partnership has also recognized gaps for different population groups and worked together to develop parent education and support programs to address the gap. This includes a program called Circle of Security, which supports nurturing relationship and attachment building between parent and child. Wordplay, a program that supports language building for both parents and children, which improves parent confidence and connections. Leap Group, or Learn, Engage, Appreciate Playgroup for parents of children with additional needs, which provides parents with information and strategies for engaging children. It also encourages access to services and increased social connections. Further to this, need for ongoing support was recognized while delivering this program, and a peer support group was established, as well as concentrated information being shared about the NDIS. With such a collection of activities, my colleague Kat will now tell us about some of the outcomes and future plans for Ready Set Prep. Thank you, Kat.
Thank you, Nazish. Given there have been so many activities and moving parts, our theory of change has also been useful in guiding the evaluation. As we work towards the overarching goal of improved early childhood development, wellbeing, and life outcomes, we need to look at indicators along the way, as it can be tricky to measure long-term population-level systems change. Today, this has involved looking at areas that can impact the determinants of mental wellbeing for the family, such as early attachment, supportive family environments, and social connections. Due to the current phase of the initiative, we don't necessarily have the comparison data yet, but I will talk you through our plan. It involves combining quantitative data with community stories to capture the benefits of community leadership and co-design. For services, we have been measuring their relationships with others with the aim of increasing service integration. We have also developed audit tools to improve service quality and welcoming environments. Combined, these strategies aim to increase family engagement and access to social and family supports, which contribute to family functioning and wellbeing. Many of the activities have been aimed towards parents and carers to provide them with support for themselves and their families. It also helps model to children about healthy and supportive relationships and community connections. Parent confidence to access services has been measured through the targeted interventions, LEAP and Circle of Security. Across 5 groups of participants, they rank their confidence to access services as 3.9 out of 5. Parent knowledge of activities and services will be measured by a community survey towards the end of the year. We will combine this data with the reach from social media and our e-newsletter, and to date we have seen our newsletter subscription list grow each month and by 13% overall. Community champions have also played a key role in sharing messages, and for community champions we conduct quarterly surveys. In their first 2 quarters, community champions shared messages with over 3,300 people, which are people we would otherwise not reach. Our champions have also reported a strong and growing relationship with Merry Health and connections with each other. We will continue with the quarterly surveys and also conduct further evaluation at the end to check in, including comparing their pre-results from the Personal Wellbeing Index, and we also hope to write a case study. In terms of children, we are largely tracking the quantitative data to date. We are looking at a combination of shorter-term indicators as well as tracking long-term data. This includes looking at maternal and child health visits and preschool enrolments, which are important for child and family wellbeing along the way, as well as the AEDC results. In 2018, positive results saw less children starting school experiencing vulnerability in Fawkner, which resulted in the expansion to Glenroy and Hadfield. We are looking forward to the release of the 2021 AEDC data, which is one key milestone for tracking our progress. However, we also acknowledge this is the first AEDC release since the beginning of the pandemic and will be an important snapshot of the wellbeing and development of local children and families after a difficult 2 years. We hope this evaluation and monitoring will support us with our next steps, as we know there is continuing need due to COVID-19. We will therefore be looking for future funding, and following co-design principles, we are open to how this might look. This might include focusing on the mental wellbeing of the whole school community, including parent engagement post-COVID. We are also keen to share our story and raise our profile, and happy to support replication of components. We also have lessons to share. Number one, supporting community input and leadership can result in greater engagement and ownership with activities. The co-design processes themselves are important for supporting engagement and developing relationships, helping Ready, Set, Prep and its messages and programs to be recognised in the community. Number two, monitoring a range of indicators is useful to help show if we are on track, and also allowed us to celebrate small wins to maintain momentum. Additionally, it allowed us to learn by doing and reshape the focus of the initiative, which is particularly handy during a pandemic. And finally, number three, our approach has many activities and soft entry points, meaning that there is no wrong door and families can become engaged in the way that it is appropriate for them. We are happy to answer any questions that you might have now, or are happy to be contacted via the details on the screen. Thank you.